Hi, everyone. Thank you for the opportunity to share research. Our research is titled Mapping Health Priorities of Ohio's Federally Qualified Health Centers.
I'm Katherine.
I'm Chelsea.
I'm Shaina.
And I'm Liz.
And we'll start with the background and our methods. FQHCs provide important medical and social services to many communities across Ohio. They're required to report information to the federal government as part of their funding commitment. This includes updating a needs assessment. We found that little is known about what health priorities FQHCs in Ohio focus on, so the goal of our research is to better understand these priorities of the FQHCs across Ohio. We gathered data from the Health Resources and Services Administration, where we organized the FQHCs by geographic location and split them amongst the team. We looked at the FQHC community health needs assessments, the community health assessments, needs assessments, and community health improvement plans to gather the priorities for each FQHC. We captured the top 5 priorities, and in some cases it was clear what the priorities for the FQHC was, and in some cases we had to make some assumptions about the priorities emphasized.
The data was coded based on priority similarity, and both raw data and coded data were analyzed. We received responses from 29 different organizations that represented 148 FQHCs in 31 locations or 31 counties across Ohio. These counties are illustrated in the map. For priority 1, we had 7 unique priorities based on raw data that we coded into 3 priorities, which are shown in the priority 1 chart. For priority 2, 13 unique priorities were found based on raw data and coded into 6 priorities, which can be seen in the priority 2 chart. And for priority 3, 14 unique priorities were found based on raw data and were coded into 8 priorities, which can be seen on the priority 3 chart.
And so as you can see, the top priorities that FQHCs chose, mental health and substance abuse, chronic disease, and access to healthcare. They're longstanding and complex challenges that communities across the nation and Ohio deal with. And in fact, the top 3 priorities were very similar to those noted in the state's health improvement plan for Ohio. And they included areas that relate to social determinants of health. They highlight FQHC's important work in increasing access to mental health services. And we also showed that FQHC's place importance on conducting the health needs assessments with community partners to determine priorities for their community.
So our study was limited, kind of as mentioned previously, but we had to make some assumptions about the health priorities that were not specifically documented, as well as we had some challenges finding appropriate contacts for each FQHC. And then finally, we had difficulties in organizing some of the raw data, as the FQHCs had overlapping topics from multiple service areas. For future directions, one of our challenges is that we weren't able to look at every county in Ohio. And so moving forward, if we were able to collect data on all of them, we would like to see if we could find regional differences in that data. So again, we just found that mental health, substance abuse, chronic disease, and access to care were the top common priorities. In the middle here, we have a Wordle, which is coded based on number of times that different priorities were shown through priority 1 and 5. So that's kind of just a good overview of what FQHCs found to be important. And then just in conclusion, obviously understanding how FQHCs prioritize needs helps us understand how they interact with their communities and what health challenges that we continue to face. And once we kind of understand these challenges, it will be easier to coordinate efforts between FQHCs to come together and work together and be able to share best practices. So my contact information is at the bottom, and thank you so much for allowing us to present this research to you.